We now have a concept presentation by Dr. Abhishek Devikar. He is a medical director at Nisargopchar Ashram in Pune. He is also president of Indian Naturopathy Yoga Graduates Medical Education Association of Maharashtra. He's going to present a concept on fasting, an integral clinical tool, a scientific approach. Dr. Abhishek Devikar, you have 18 minutes. Now we have Dr. Abhishek Devikar presenting on fasting, an integral clinical tool.
Yeah, thank you, Dr. Rita. Good afternoon to everyone there. I hope you all have great learning since this morning. And coming to my clinical experience, as Dr. Rita mentioned, I'm basically a clinician and I belong to Nisargopchar Ashram, Murli Kanchan. With a small experience of 12 years in the past, I was fortunate enough to come across many rare conditions, rare diseases, which we could treat here through yoga and naturopathy. And also fasting was an integral tool in treating those conditions. So I was also privileged to have a guru and mentor like Dr. Nisal, who had been administering fasting for acute as well as chronic conditions. With his blessings and his knowledge sharing, we could reach a stage where we could connect the dots between philosophy and science and made scientific approach through fasting in many conditions. Now, in this session, I would like to...
Abhishek, kindly switch on to the PowerPoint mode,
Sure.
Individual slide.
Yeah, is it visible now?
No, you will have, on the right bottom, you will have to just press on the slide share button.
Is it visible now?
No, it is still on. Can you just click on the slideshow option? On the right bottom of your screen, you will get this option for slideshow. Yes. Your screen is visible. Okay, continue.
Okay, is it clear now?
Oh, yes, it's visible.
Okay, thank you. Yeah, so in coming few slides, I would like to share my clinical experience here. And basically, in our clinical setup, what kind of common conditions we encounter and how a clinician or a student or an intern can build up their confidence in administering fasting for common clinical conditions. So to begin with, first let's know what is fasting. So briefly, as we all know, fasting is the voluntary abstinence from any kind of food for a limited period of time, which suggests that no food which needs digestion should be given, or any food substances which can hamper the metabolism or the metabolic rest should not be given during fasting. Now, apart from this, there is a difference between fasting and therapeutic fasting. Therapeutic fasting consists of a medically supervised inpatient multidisciplinary fasting regimen with 3 dimensions that can be used for prevention, health, or as therapy. Now, there are different forms of fasting. The first one is based on the state of health, the therapeutic fasting, which is commonly practiced in most of the naturopathy centers. The second one being the preventive fasting, which is commonly practiced as a part of detoxification. And the third one being the fasting for health, which may or may not be intended for any medical results, but at the same time, it can be practiced by health seekers on their own. Now, the second classification is based on the type of supervision, whether the supervision is by physician at a hospital, that is inpatient, the outpatient one, where the local physician guides the patient to undergo fasting, and the third one is where there no supervision is there, a patient follows either fasting guides or self-googling, which is definitely not recommended for a common person. Now, the third classification is the most important and integral aspect, which forms the basis of fasting therapy, under which we see partial day fasting, which goes from 18 to 24 hours. The second form is single day or short term, which goes from 36 hours to 48 hours. The next one is multiple day, which is medium term fasting, which goes from 2 to 4 days. 5:2 intermittent is another one, which can be practiced twice a week, either subsequently or it can be in a gap of 1 or more days. And the last one is the most common one, long-term fasting, 4 days and above, which is practiced in naturopathy centers for best results from fasting. Now, it is important to know what is the ideal duration of fasting. Now, the duration of fasting varies from person to person based on their physical and physiological needs. It depends on the clinician and his expected outcomes, that what amount of fasting he is looking at to derive a particular outcome from the duration of fasting. But ideally, 18 hours of fasting, which can go up to 21 days, can be administered, and up to 21 days is considered as very safe. Now, the evidence also suggested that 12 hours of fasting is required to create a marked change in the gut. Now, gut being the closest organ affected while fasting needs 12 hours of fasting to see a marked change. That means minimum 12 hours of fasting should be there, and ideally it can go up to 21 days. Now, in our clinical setup, we come across few most common conditions like obesity, diabetes, dyslipidemia, hypertension, coronary artery disease, inflammatory and neurological conditions, PCOS, and cancer. Now, I would like to dive into the scientific basis of these conditions, that how fasting helps or affects in these conditions. This will enhance our confidence in clinical practice while executing the fast. So, coming first to the obesity, now we are all well aware that obesity forms the basis of most of the clinical conditions in today's world. Fasting, which is an outcome of insulin resistance in most common condition. Insulin resistance is well known by all of us, which is a double-edged sword, which give rise to obesity. Once obesity keeps on rising, it again hampers the insulin part of the story, and insulin resistance further worsens. So both complement each other in worsening the scenario. Now, fasting, if we see from the molecular basis or molecular mechanisms behind what exactly happens during fasting, so after 12 to 16 hours of fasting, the glycogen content in the liver activates the metabolic switch, which causes reduced levels of glucose. This leads to a drop in insulin levels, where the hormonal mechanisms comes into play. Hormones like human growth hormone causes reduction in circulating amino acids, and at this juncture, the central nervous system releases noradrenaline and causes lipids from adipocytes to convert it into free fatty acids. The free fatty acids now basically are used up by the muscles, kidney, heart, and liver for production of energy. So it is also very well known fact that fasting can give a marked weight loss, and it can be measured in terms of abdominal circumference reduction, whether it may be acute fast or long fast, short term or long fasting, both has a good pronounced effect in fasting. Now, moving on to the role of fasting in diabetes. In anybody's clinical practice, all the clinicians and doctors are usually skeptic and reluctant to administer fasting for diabetic patients, for obvious reasons, that it is believed that a diabetic patient must be given frequent meals, maybe every 3 hourly is best to maintain their sugar levels. Now, from that scenario to coming to a stage where we execute fasting is a long journey, but we are blessed that we know the science behind it. And in conditions like pre-diabetes or early diabetes, we have seen that when we give fasting, the insulin resistance, which is the main culprit here, gradually reduces, and which brings down the blood sugar levels at a normal level. So when we see gradual reduction in insulin resistance, over a period of time, it turns into insulin sensitivity. And insulin sensitivity is nothing but basically reversal of diabetes. In chronic diabetic cases, it is usually difficult, or it's believed that it can be a contraindication. But to everyone's surprise, intermittent fasting works best in cases of diabetes because the frequent meals are replaced by fewer meals, and obviously the glucose, the insulin, and the burden on the pancreas gradually reduces. Now, in a clinical setup like ours, what we initially do is we give them a boiled, bland diet, and gradually tapering their medicines and insulin, we bring back them to an intermittent fasting stage where 8-hour window is given for eating and 16 hours window is given for fasting. Now, with this background, we give them a training and a detailed, comprehensive guide about how they should be continuing periodic fasting in terms of their daily routine, and also some lifestyle habit corrections, modifications, which complements both the activity of fasting as well as lifestyle to control their diabetes. Now, once this is set in, then we see that there are some scientific changes which happens in the body, like there is decreased number of meals which causes reduced insulin production, and there is insulin sensitivity, and which definitely improves the blood sugar level, both fasting as well as PP. The metabolic switch basically utilizes the glycogen in the liver, and after 12 hours, it is used up for energy production via beta oxidation. The insulin reduction also gives an extra edge by not giving the propensity to gain weight. Also, when they follow this kind of a routine for 2 to 3 months, the important marker, that is HbA1c, improves within 2 to 3 months, bringing the levels to a normal range. So this way, fasting is very much important and efficiently practiced for bringing down or reversing the diabetes. Moving on to CAD, I would not like to go much into the depth of it because this morning Dr.Praveen Jacob has beautifully explained the different aspects of fasting and coronary artery disease. But in a brief note, I would like to just convey that insulin resistance is usually associated with high inflammatory state, increased CRP levels, elevated adiponectin, reduced LDL level, and metabolic factors. Now, this is basically an ideal environment for atherosclerosis as well as coronary artery disease. On the other hand, insulin resistance is already known for its atherogenic as well as fluid retention properties, which forms the basis of congestive heart failure. Now, when we execute fasting for almost 2 to 3 weeks, we have seen that reduced insulin levels brings a positive change in the heat shock proteins, the levels of adiponectin, the inflammatory cytokines, and also it promotes cellular autophagy. So this basically improves the cardiovascular health, and even while treating these two conditions, this plays a vital role in giving us the benefits. So we have seen many cases where people were detected with CAD and they were asked for surgery, whereas they were very much reluctant to go for it. And when they came to our center, we have given them a detailed counseling about how fasting works. And when a fasting of a significant period was executed, we found that in 2 to 3 weeks time, their exercise tolerance was better, their TMT improved, and after a due course of period, when they went for a subsequent checkup to the doctors, they found that the blockage was much minimal, and so there was no need for any surgery. So we have such cases where fasting has shown great results even in CAD. Fasting is already known for its cardioprotective properties, and it provides resistance from ischemic injury. Fasting modulates the levels of visceral fat as well as several additional adipokinins, insulin insulin-like growth factors, the TNF and IL-6. It is also known for reducing the blood pressure by stimulating the parasympathetic activity due to the release of BDNF, and also there is increased renal excretion of sodium and enhanced receptor sensitivity of natriuretic peptide. Now, fasting can also play a preventive role in cardiovascular risk subjects by enhancing the emotional as well as the physical well-being. So, fasting has lot to offer even in cases like CAD. Now, coming to the condition which is most common in a woman of reproductive age, PCOS. Now, we have been coming across many females who wish to lose weight, those who are obese, and on investigations like ultrasonography, we come to know that they had either PCOD or PCOS. Now, while treating them, we come across more females who are finding it difficult to conceive. In spite of IUI and IVF, they have been finding a difficulty in conceiving. And when in such conditions we have executed fasting, we have results and commendable uh, cases where we have seen that they could conceive very comfortably. So technically, the physiological changes what happens in PCOS is usually associated with insulin resistance, dyslipidemia, hyperinsulinemia, obesity, and infertility. Now, this usually causes hyperandrogenism, further leading to chronic anovulation, which basically disturbs their regular menses or menstrual cycle. While fasting is administered, there is a reduction in circulating insulin-like growth factor 1, insulin-like growth factor binding protein 1, and which leads to decreased glucose and insulin levels, bringing about a normal level of androgens and ovarian functions. So this way it can very smoothly and easily over a period of 2 to 3 months help females in coming out of PCOD, PCOS, and even cases like infertility can be dealt very scientifically. Now, in today's scenario, when COVID-19 catastrophe is everywhere around us, we are all talking about immunity. We are all talking about how to get rid of bacterial as well as viral infections. And this is a time where prevention is coming into picture. Everybody is talking about prevention. Till date, everybody was busy talking about when somebody is infected, what should be the line of treatment. But now we are at a stage where we are thinking about what are mechanisms which can build our immunity and help us in fighting different infections. So with various researches, it has been proven that immunity can be efficiently improved by fasting. So this is also an area which needs to be explored, especially in a clinical practice. Now coming to the next condition, which is inflammatory and neurological conditions. So we have treated many cases. I'm sure most of the naturopathy centers receive such patients where inflammation is the main cause. And behind inflammation, there is always stress, poor lifestyle, and obesity. So this trio basically makes it worse and affects somebody's immunity in such a stage that they can turn up into an autoimmune disease like rheumatoid arthritis. So I would like to quote an example of a case of rheumatoid arthritis where a female was, many such patients, not only one female, but many such patients have been coming here with complaints of morning stiffness, swelling, pain, and after a detailed case history and going through their medicine history where they were asked to take painkillers, analgesics, NSAIDs, and also in cases like where steroids was administered, they were all having symptomatic relief, but they could not come out of this condition. And every seasonal variation would trouble them in terms of aggravation of symptom. So in such cases, after tapering their drugs and counseling them in terms of fasting and its benefits, when fasting was administered for 21 days, we found some dramatic changes where the swelling, pain, analog scale definitely reduced, but also there was improvement in the quality of life index. And there are cases where rheumatoid arthritis patients have turned negative also. So this way, by boosting the levels of antioxidants and reducing the levels of pro-inflammatory cytokines, uh, they are like
Doctor, we have 5 minutes remaining.
alpha 1 and interleukin 6. Now basically these all helps in improving the inflammatory conditions like rheumatoid arthritis while administering fasting. In neurological conditions, it has shown enhanced performance in cognition, mood, motor, as well as autonomic nervous functions. And the main link between these is release of BDNF. So BDNF is a known neuroprotective agent, and due to the reduction in insulin and leptin levels, the action is on the hypothalamic pituitary adrenal axis, thereby it impacts the mood positively. There is release of endogenous opioids like endorphin, and also the research says that ketosis is also another agent which basically has a positive effect in brain functions. So in this way, even neurological conditions can be effectively addressed via fasting. Now, coming to the last condition in our chart today, that is cancer. Again, about cancer, I would not like to go into the depth of it because Dr. Raghavendra Rao has explained in detail about it. But in a nutshell, during fasting, we have seen that there is reduction in glucose, insulin, leptin, as well as insulin-like growth factors. Also, there is a rise in adiponectin levels, which are known for its anti-tumor effects. There is rise in ketone body levels, which is known for its slowing down of tumor growth factors. And there is enhanced autophagy, which is already an anti-cancer immunity agent. So in this way, we have seen that fasting can help in reducing that it was worsening, and he was advised to undergo for a surgery and subsequent radiation therapy. But as the patient was a firm believer of naturopathy, he came to us seeking help from Israel. Now, in this condition, in this aspect of the case was he was completely surrendered to us and he was willing to do whatever was said to him. So as we follow a normal protocol in other cases, initially we gave him a naturopathic sattvic diet, and later he was explained about fasting and its beliefs and how it can benefit in this particular condition. Now in fasting, after 2 days of normal food, he was given fruit diet for a couple of days, and then gradually he was asked to start the fasting. So the water fasting went on up to 17 days, and after 17 days of water fasting, we gradually brought him to fruits, juices, fruits, and followed by normal food. Now, his results were quite interesting for all of us because on admission his levels, PSA levels were 7.7, and on date of discharge on 40th day, it was 5.9. So which was a good change, which was a motivating change for all of us. And then we gave him a complex periodic fasting program to be followed. And during the fasting periods at Israel also, he was followed up properly. His vitals were taken care. And after 6 months, when his doctors repeated the PSA, it came to 4.4. And to our surprise, after 1 year when he was following all these, we found a change of 3.9. So basically, he was very much close to a safe range, and his discomfort has already reduced. And the overall progress in this case, the remission of cancer was evident in this case, which was very interesting and very encouraging for all of us. So with this, I would like to just summarize that fasting is not only good for obesity, hypertension, dyslipidemia, diabetes, or even coronary artery disease, many conditions, inflammatory conditions, neurological conditions, PCOS, as well as cancer, and so many acute conditions also can be very well dealt with fasting at a clinical setup. But the most important area is one should have a sound philosophical knowledge and scientific approach while administering fasting. Now, take home message should be that we should be confident in treating cases or different health conditions using fasting. But it is also important that the clarity of mind is important for the physician who is administering fasting. While administering the fast, it is very important that you monitor the patient throughout the course of therapy, and we have to be very vigilant about any fluctuations in the physiological condition. Now, with this, one of the naturopathy principle, which is called as Panchatantra, which explains about fasting once a week, come into picture, which was supposed to be a preventive tool, but now fasting has grown where it has taken the curative aspect as well as. So, with this, I would like to conclude that fasting should be used as an integral tool in clinical practice, and all of us should be confidently practicing fasting in our clinics. I would like to thank the Dr. Praveen Jacob, Dr. Arun Tejas, all the organizers of this conference, and all of you for joining in. Thank you.
Thank you, Dr. Abhishek Devikar, for scientific and a very informative presentation on fasting and integral clinical tool. Thank you, Doctor.
You're most welcome. It was wonderful having all the speakers today. I've been hearing them, and it was nice of all of you to hear so patiently and give me a chance to share my clinical experience. Thank you.
We will now move on to our next presenter. We have a session by Dr. Saranyan. Dr. Saranyan has an experience of over 20 years in clinical practice, and he is a member of various committees and governing bodies such as National Institute of Naturopathy under Ministry of Ayush. He is a member and executive chair for International Congress on Naturopathic Medicine. He is also a member of Technical Committee NABH Quality Control of India. Currently, he is serving as a medical superintendent at RK Nature Cure Home, Coimbatore, Tamil Nadu. Dr. Saranyan, it's an honor to have you with us. May I kindly now request you to present on therapeutic fasting, a game changer in clinical practice. Over to you, Dr. Saranyan.
A very good afternoon to all of you, and my greetings to all the August panel members who are there, Dr. Raghavendra Rao, Dr. Manu Pradesh, Dr. Praveen Jacob, and Dr. Venkatramana Hegde, and all of them who were there, and Dr. Swaminathan who just had his talk completed. So very good afternoon to all of you. I am here to basically talk about fasting as a game changer. That is like therapeutic fasting, which will be a game changer in clinical practice. That is what is my talk. And my talk is going to be largely a reinforcement of what exactly all of them spoke. It's something like we have already listened to a lot of finer and deeper technical material about how fasting works, the molecular part, and all of these things. But all I would like to tell is, in a very simple form, how this is going to actually work as a game changer. So when we talk about fasting, like before we talk about fasting, it is very important to know like what exactly are people doing and what kind of people do approach for nature cure physicians and try to get help from them to get all right. So when we try to understand that, most like in a present society, it is like all of them are used to having 3 meals a day, and some of them of course have an increased frequency of consuming meals. But the largest problem with most of the people who turn to or look forward to alternative methods or to nature cure or yoga methods or even any kind of Ayush methods to find help and then relief from their problems, uh, predominantly a large section consciously or unconsciously will be having this problem of overconsumption of food. Probably they may not be aware of how they are overeating or what is actually going wrong. It could be the reduced frequency, increased volume, or increased frequency with varied volume or erratic pattern, but ultimately it ends up in having overconsumption of food, which actually causes most of the things are available and everybody of us familiar that a lot of metabolic morbidities turn up when we have excess consumption of food or overconsumption of food, which are the most common challenges.
Yeah.
Hello.
Sir, can kindly switch on to the presentation mode, please?
You are not able to see that?
No, you are actually on a slide mode. You just have to switch to the individual slides.
Is it okay now?
Yes, sir.
Is it okay now?
Yes, yes. Perfect.
Okay, thank you. Thank you. So the most common problems what we face, as a big challenge will be like insulin resistance is coming up with many people. It is not only with metabolic syndrome, a lot of number of cases of PCOD, PCOS coming with insulin resistance, and then the biggest challenge becoming visceral fat for everybody. Because everybody knows what is to be done to lose weight, what is to be done to stay healthy, and what is to be had and what not to be had. But the biggest problem with everybody, despite knowing all these things, is how to start, how to do it, and how appropriate to do it, because there is a lot of information coming up in the social media now. You have so much of information, and when they are not professionally guided, they end up following either overdoing something or underdoing something, where they don't find results. Then at a particular time, the morale and the psychological aspiration to take it forward is completely lost. So what we would like to address is, therapeutic fasting, when inculcated very clearly and in a correct manner, will definitely start giving a lot of results. So results are not only going to be related to the body, somatic changes, but also a huge component of the psychological benefits of fasting, which is still not completely explored. There is a lot of scope for us to work on that area. Now, fasting is one aspect. You talk to them, they finally are convinced, they start practicing fasting. But then the biggest problem is, after fasting for the next 5 days, you'll have to be very careful in monitoring them, because if they start binge eating, then the entire effect of fasting is gone. So it is very important to educate them that after fasting to abstain from binge eating. And the next thing, why fasting? When we talk about science and so many aspects of fasting at a molecular level, this is not something which is ancient to us. Fasting has been in our cultural practice from very long time, and probably it was given more of a cultural fabric, so we didn't look at it scientifically. But then when we try to analyze and look into things in a lot of detail, most of the cultural or traditional practices had a very strong scientific background behind it. So now there are different kind of civilizations, different kind of ethnicities, different geographical locations in the world have been practicing fasting in various methods and patterns. So it has been traditional, cultural, or religious, but everything had its own reasons by narration. But if we think of going back to those scenarios where they lived and practiced this, that definitely makes sense that it has been a very scientific practice. Now, when we talk about, a lot of research papers available, in PubMed and scientific status journals, there are a lot of research papers, a lot of scientific work has happened. But when we try to understand fasting, if you try to modify it therapeutically, it can be as short as 2 days or 5 days, 7 days, 10 days, 21 days. Some people, 21 days. Some people, can manage to, guide their patients to go for 30 days fasting, or even 48 days fasting. There are very specific conditions which have seen significant improvement and very positive results, like rheumatoid arthritis, chronic pain syndromes, hypertension, metabolic syndromes. They definitely find a very, very positive and encouraging result. So now, when we know that all these things are happening, fasting, if it is always, supported by counseling the person to gradually shift his lifestyle by understanding and then following a vegetarian diet, it gives very good results. It's not like blindly you preach, you enforce, and it comes back. There is a lot of science adding up to that, and then it starts actually working much, much better. Now, we had talked about this right from morning, because I've been listening to my former speakers who have been, doing an excellent explanation, or rather a dissection of what we had studied in our college times, and we had been practicing from very long, but in the macro and micro level. So a brief glimpse of that. There is a lot of confirmation and faith building and confidence building in accepting therapeutic fasting as a very important part in the clinical practice. So various identified mechanisms of fasting, which always, promote a person's or individual's system or homeostasis into health. One is like fasting induced neuroendocrine activation, and hormetic stress response is something which is very vital. There are a lot of scientific evidence backing this up. Increased production of neurotropic factors, reduced mitochondrial oxidative stress, which happens when, fasting is some of the simplest and easiest way of doing. There are a lot of other plant-based products, nutraceuticals, so many other aspects are able to produce this. But then this is something which is, we are able to do it by self-reliance. Another one is general decrease of signals associated with aging and promotion of autophagy, which has been extensively talked today. Now, we all know that with all these mechanisms which are being explored, studied, publicized, and then again and again being emphasized, But the core point here is there are a lot of methods being explored and tried to find this out by taking something or by inducing something externally. So what we are trying to emphasize is when fasting can be done by us,
Excuse me, Dr. Saranyan.
or we can guide someone through fasting, there is a lot of emphasis which needs to be given to achieve these aspects. And when we say that this is actually happening,
Excuse me, Dr. Saranyan.
from our clinical practice or from our moral stand of view as hello.
Yeah,
Yes.
sir, there seems to be
Hello.
an issue with your network. Could you please turn off your camera and continue with the presentation? Your voice is breaking. So,
Oh, sure, sure,
yeah.
sure. One minute.
Yeah. If you just turn off the camera, your voice will be clear. There seems to be an issue with the network.
One minute. One minute. Yeah. Hello.
Yeah, kindly switch to the presentation mode, slide mode.
Yeah. You're able to see this now?
We can see your slide, but you just need to switch to the individual slide. Yes,
Right? Is it
yes,
visible now?
yes, sir.
Yeah, fine. Thank you. I'm sorry about this internet connection problem.
Not a problem.
So when we talked about all these above mechanisms in which fasting is definitely going to help, we need to collectively pull in and try to use this portal for very frequent discussion and a lot of open discussions where we are able to pull in data and collectively bring out controlled clinical trials and observation studies, which is going to emphasize this more and make it more simpler and evident for people to practice. Now, something which is very important, when we talk about therapeutic fasting, and we know that therapeutic fasting is a definitive method which is going to improve health, prevent many major diseases as well as aging. Now, despite having told all these things, we always have to be very cautious that it is not going to answer everything. But then, largely, where it can provide an answer and give very good solution, there are so many aspects and factors which have to be very carefully, handled so that we are able to derive that benefit. One is choosing the right patient. We'll have to be very careful in choosing on whom are we going to advocate therapeutic fasting. So choosing the right patient is very important. And once you are able to choose and you are convinced that this person is okay, is clinically going to be fit for fasting, then the most important aspect becomes education about fasting to the person and counseling them what is going to happen in their body, what are they going to experience, and how they are going to get through this. Because if the person is doing something which he himself is not understood or he is not clear about, there will not be complete participation. And when there is not complete participation, he feels it's some kind of a sacrifice he is doing, then that will also have its own impact on various hormonal and molecular changes happening in the body. So one is that is a very, very important factor. The second factor is preparing a practically robust preparation protocol. It's not like we decide that this patient, yeah, we want to put him on therapeutic fasting. There could be like I was hearing a lot of questions of chronic disorders and long-term disorders happening. So I don't think a person, when we tell immediately you tell him into fasting, they will do fasting because we are guiding through. But then a person to effectively fast by realizing and comfortably and wholeheartedly subjecting himself for a therapeutic fasting needs a lot of preparation. So we need to prepare them systematically in terms of how to bring down in terms of their food intake, caloric intake, modifying the quality of food so that they are actually prepared for getting into therapeutic fasting. Sometimes it may take days, sometimes it may take weeks or months also. And I've practically seen that with my patients. So that is something which is very important. And the next part is close clinical monitoring and very good plan of action to choose the medium of fasting and the duration of fasting along with support therapies and practices. So therapies are something which we would be doing or we would help them to practice by themselves. And certain practices which include like the most important question, the previous session somebody was asking, giving the body optimal rest. That is something which is very important. Along with that, some very important practices like, exposing yourself to a good amount of sunlight, and then some breathing practices which will be designed and planned according to the clinical condition what you desire. So close clinical monitoring and very good plan of action as to what medium you're going to give fasting and how much duration are you going to take the fasting for, along with support therapies, is very, very important. And then comes the toughest part, but clinically the most significant part: extreme care and professional guidance in breaking the fasting. Because most of them now, of lately, I think intermittent fasting is picking up with a lot of awareness. People are, looking forward. There are a lot of people who are, venturing into practicing intermittent fasting. Many are successful. Many people taste success, but then again, get back into kind of what we call as an yo-yo effect. They get back into something which is even more bad than what they began from. So breaking the fast is something which becomes very important, because that is actually the place where many of them, stray away from balance or make mistakes. So that is something which is very important. Next thing is counseling for lifestyle modification to bring in discipline and consistency of health practices. Something like we talk and advise them that these kind of physical activities, try to begin as plugins in your pranayama, or whether it's going to be 20 minutes of yoga or any kind of physical activity. We will have to counsel them and make them actually realize to a level that they need not have a monitoring, or somebody need not push them to do that, and they actually start enjoying doing that. And that has to be very, very consistent. It is not like, for 15, 20 days they did, and again they left it. Then after 3 months they started off with something else. Then again they left it, and for 6 months there was nothing actually happening. These things, when we look at some kind of, therapeutic fasting on a long run, it is going to be a very difficult challenge to face. And then the last and most important thing is very clear education to the people to avoid overdoing any kind of practice, whether it is therapeutic fasting or practices associated with therapeutic fasting, and any other kind of hyper enthusiastic fasting. Like, when they try to do fasting, they will be guided with a particular module, and in their friend circle they might have heard something. All of a sudden they start doing dry fasting with no preparation. All of a sudden they start going on water fasting with no preparation or guidance. So these kind of hyper enthusiastic practices definitely do cause a problem, and they are not actually prepared for that, and they are not clear as to what to look into it. So this particular these 6 points what I told, choosing the right patient and having a practically robust preparation protocol, close monitoring and support therapies, extreme care and professional guidance to break the fasting, and counseling of for lifestyle modifications, and not overdoing anything are very, very key to have therapeutic fasting actually go by the meaning what we called as a game changer in clinical medical practice. Okay. Now, this is what I told was all about the importance of fasting. Now, what I'm just trying to tell is I'm just trying to share some clinical case series what we had. Of course, we have a lot of information, but respecting the amount of time given to me, I would like to share some that is basically to show that the fasting definitely does work if it is done properly, irrespective of duration and time. Now, this is a particular study which I'm just trying to share with you. It's like, it's about a case of a 55-year-old female patient who was diagnosed for polypoid mucosal thickening of gallbladder. She had a lot of symptoms of acid peptic disease and digestive discomfort in the beginning. You can see the yellow and green slides. Yellow marks the first one, green marks the progressive next one. So it was something like, on June 2017 was somewhere first when this polypoid thickening was noticed, and all these symptoms were there. So I had to take a duration from June till November to slowly start her lifestyle to be modified, her dietary practices to be modified even before putting her into fasting. So when we try to see that, it was like two polypoidal mucosal thickenings of 5 mm each on June 2017, which became 17, just by correcting her dietary pattern and lifestyle modification. And then February, when we see, it remained the same 5 mm. After this is where we started teaching her fasting, and it was basically like fasting for 2 days in a week. Every weekends we were told her to be on fasting, and that started showing results from March. So March 2018, the polypoidal mucosal thickening came to 3 to 4 mm, And again, when we tried to repeat it in November, it was a single polyp of 2 mm. After that, the patient didn't come up for follow-up. But this is basically trying to give you an example of some kind of weird conditions which people come for looking for naturopathy, which is very unlikely and less common of people coming for such conditions. This is another interesting case, a 21-year-old female patient who had approached primarily for infertility. And when we tried to see them, she was telling she had been under medical treatment for infertility, and her gynecologist had been treating for almost 3 to 4 months. And she was asked to run a test for her thyroid levels, which obviously showed up to be very, very high. You are able to see the reading. It's on 12th March 2018, which was showing TSH levels, about 150. And this is the stage when they came in, and we were not able to admit this patient. She had to do everything on her own as a home program because of her, we can say, affordability pattern. So we had advised to practice fasting. Only when she worried about her infertility, so that was her motivation to follow very well. So from March till June, you can see for the thyroid stimulating hormone levels has come to 2.98, and I think she came up after that only in December to tell us that she had tested positive for pregnancy. And this is another 59-year-old lady who had come for hypothyroidism. She had been under treatment for almost 8 years, and she had been shifting places because she belongs to, her husband belongs to the armed forces. So she had come with this, and by then she didn't had a very less inclination to continue with medication. So she was asking whether it is possible to do something without medication. I told drastically it may not be possible, but if she's willing to walk it along with gradual lifestyle modification and adapt certain practices for a long time, then it can definitely happen. So the initial reading what you're seeing is on June 2017, and the next was on April 2018. So we had to take a very long duration of almost 4 months to prepare her. After that is where we started advocating fasting for her. This was kind of after all the dietary modification, it was fasting weekly once. So you can see the results in front of you. It was TSH 5.26 with medication, and then from 4 months after modified diet program where medication was completely stopped, and then she came with only lifestyle practices, dietary guidance, and fasting for once a week consistently for all the weeks for almost a duration of 5 months. So that is where TSH came to 0.03, and then energy levels are much, much better. So this is about hyperthyroidism. And this is about a very another interesting patient who had come accidentally, thinking that it was an Ayurveda hospital, and she had come to ask about some internal medication for her ovarian carcinoma. She was diagnosed, and then she had undergone chemotherapy and radiation therapy. She had recovered, and then she again had a sudden relapse. So once the relapse happened, then she was not interested to get back into the same kind of procedure what she had faced earlier. So we were very skeptical. We had to counsel her and her son to tell that it will be a wait and watch situation. We'll have to progressively see how she improves. So we will not be able to tell anything for sure. But if she's willing to take up nature cure, then we can help her. So this was somewhere in January 2018. So from there we started modifying her, but we had to add some more healthy practices like oil pulling, and then there was a component of pranayama which we included in her, and some dietary restrictions and fasting. For every second day she was advised to do fasting with wheatgrass juice as well as other light juices which we had specifically formulated for her. Progressively, when she was able to do that, and gradually her gastric discomfort, pain, weight loss got arrested over a period of 3 months. And then from January till June, we are able to see the results of CA 125 from 44.9 coming to 8.3. And she was largely stable, and she had to go in for a second opinion, and they had given her medical advice, and they also advised how she was able to do this without coming in for radiation. She explained to them that she had been doing all these things, and those set of oncologists were very positive. They were very uh, kind and broad-minded, and they had advised her to carry forward with this. And then she was able to successfully handle her relapse and have a better quality of life. So these are some of the examples of patients which had benefited from therapeutic fasting, but something like on a long term with continued guidance and monitoring. This is what has happened. So therapeutic fasting definitely will be a game changer in clinical practice, provided we are able to take care of these preparations. This is becoming, this is very vital. Even if patient are not admitted, there needs to be a connect with them constantly, where they need to be guided to go in for practice. So this, yes.
Yeah, we have come to the end of the session.
Yeah.
So we have only one question: whether fasting is recommended.
Pardon?
We just have a question for you. Is
Yes.
whether fasting is recommended in hyperthyroidism?
Yes.
Whether fasting is recommendable for hyperthyroidism?
It's something like, it is not like, blindly telling recommended or not recommended. It is person to person. You evaluate, talk, choose, and then design what kind of fasting and in what module you're going to put them or guide them through fasting. It's not
Okay.
like something kind of a prefixed SOP kind of a thing.
Okay. Yeah. I think that answers Nageshwari Rajendran's question. Thank you, Dr. Saranyan, for stressing on importance of following guidelines while prescribing a therapeutic fasting, and also presenting the evidence on efficacy of fasting in treatment of various diseases. Thank you, sir. Thank you for your presence.
Thank you.
We'll now have
Thank you very much.
Dr.
And I would like to thank Dr. Praveen, Dr. Arun Tejas, and Dr. Rita for having me on this program. Thank you very much.
Thank you, sir. Yeah. Now we have Dr. Raghavendra Rao, who will address us for a minute. He has an important announcement to make. Can we have Dr. Raghavendra Rao?
Here, Dr. Rita. Good afternoon, everybody. It has been a very interesting talk to see here Dr. Swaminathan speak about the molecular mechanisms of fasting, and my colleagues talking about fasting and therapeutic effects of fasting. Just to make a small important announcement. So what we were thinking was CCRN has partnered with Eco India Network, and this is a big network where we are trying to improve the capacity building of all the healthcare practitioners. So in this, we are going to have a lot of activities like webinars, training programs, case discussions in the weekends on using the Zoom platform. But one thing about this Eco India platform is it can reach to about 10,000 people at a time. Okay, so this is a very good initiative which we are trying to do from the CCRN. And what idea which I also got was that we also will start a study interest group in different areas of diseases, and we will devise database platforms where we'll try to accumulate more data of our treatment individual cases, so that we have huge number of case studies at the end which can be publishable. Okay, so basically what I found out was in the 2 case presentations, I just want to make my opinion on this. We need to have a standard template to define the particular diagnosis of the condition. For example, in the first case, the condition was on cirrhosis. Cirrhosis is not a disease. It should have been alcoholic liver disease, ALD, basically. Cirrhosis is a pathological condition, basically. And we also need to use the right kind of measurements to evaluate the outcomes. For example, in the first case, where is the alcoholic liver disease, if you had used a fibroscan, you would have known areas of fatty changes, areas of fibrotic changes in the liver, and compared the pre and post easily. Similarly, in the second case study on Hashimoto's thyroiditis, defining this is also very important because it's a chronic disease, chronic autoimmune disease. And a more objective measure instead of TPO or ATG could have been a scintigraphy. Okay, like for example, if you have done iodine 131 scan, you could have found out the number of areas of cold nodules and hot nodules, like functional thyroid areas and non-functional thyroid areas. And if you could have seen a change in those areas before and after the intervention, this would have been more important, can say is a more evidence-based kind of thing, which is more convincing approach compared to just antibody titers, because TSH and antibody titers are available to so much of variations, and with also with respect to medications like erythroxine, levothyroxine, which the patients take, this can change these levels automatically. So there will be a lot of confounders, whereas the scintigraphy is devoid of those confounders. So what my take is that we have the right kind of investigations, robust investigations. We form a study group in different areas, and we have frequency. We increase the frequency of these meetings so we can exchange ideas for the better of the community here. Thank you all. Thanks for the wonderful sessions going on.
Thank you, Dr. Rao.